Hello everyone, now let us discuss the 2023 E&M coding guidelines for interprofessional telephone, internet, electronic health record consultations. Coming to the electronic health record consultations, the consult should use the codes 99446, 99447, 99448, 99449 and 99451 to report interprofessional telephone or internet or electronic health record consultations. These are the CPT ranges. An interprofessional telephone or internet or electronic health record consultation is an assessment and management service in which a patient's treating, attending or primary physician or qualified healthcare professional requests the opinion and or treatment advice of a physician or other qualified healthcare professional with specific specialty expertise. The regular physician will request the opinion and or treatment advice from other specialists to assist the treating physician or other qualified healthcare professional in the diagnosis and or management of the patient's problem without patient's face-to-face contact with the consultant. Here, patient will not have any face-to-face contact with the consultant. The patient's primary physician will have the discussion with the consultant. Patient will not have any face-to-face direct contact with the consultant. The patient for whom the consultation is requested. The patient for whom the consultation is requested may either be a new patient to the consult or an established patient with a new problem or an exacerbation of an existing problem. However, the consult should not have seen the patient in face-to-face encounter within the last 14 days. In order to quote these codes, the consult should not have been seen the patient face to face in the last 14 days. When the telephone or internet or electronic health record consultation leads to a transfer of care or other face-to-face services, we have discussed that this is not a face-to-face service with the patient. If this consultation service leads to transfer of care or other face-to-face service, for example, surgery, hospital visit, or a scheduled office evaluation of the patient within the next 14 days or next available appointment date of the consult, these codes are not reported. If this service leads to face-to-face service within the next 14 days or next available appointment, then you should not use these codes. These consultation codes are not reported. Review of pertinent medical records, laboratory studies, imaging studies, medication profile, pathology specimens, etc. is included in the telephone, internet or electronic health record consultation service and should not be reported separately when reporting these services. Review of the medical records, laboratory studies, imaging studies, medication profile, pathology specimens are included in this codes and they should not be reported separately when we are reporting 99, 446, 447, 448, 449 and 451. The majority of the service time reported, that is greater than 50%, must be devoted to the medical consultative verbal or internet discussion. More than 50% of the time must be devoted for the discussion with the consult. And if greater than 50% of the service time is devoted to data review and analysis, then 99446, 99447, 99448 and 99449 should not be reported. If more than 50% of the time is devoted for data review or analysis, we should not report these codes in the series 99446 to 99449. However, the service time for 99451 is based on total review. That is, both data review and analysis, and also the interprofessional communication time is included in 99451. If more than one telephone or internet or electronic health record contact is required to complete the consultation service, that is discussion of the test result. If more than one telephone or internet or electronic health record contact is required to complete the consultation service, the entirety of the service and the cumulative discussion and information review time should be reported with a single code. That is, the time should be added. If more than one telephonic or internet electronic health record service is required to complete the consultative time, consultation request, then the entirety of the service and the cumulative discussion and information review time should be reported with a single code only. And the codes 99446, 447, 448, 449 and 99451 should not be reported more than once within 7-day interval. These codes, they also apply the 7-day interval. They should not be reported more than once within the 7-day interval. What are the codes? 99446, 447, 448, 449 and 451. Written or verbal request for telephone or internet electronic health record advice by the treating or requesting physician or other qualified healthcare professional should be documented in the patient's medical record. The request for consultation along with the reason for visit must be documented in the patient's medical record. There must be a written or verbal request that must be documented in the patient's medical record, including the reason for visit. And the codes 99462, 449 conclude with verbal opinion report and written report from the consultant to the treating or requesting physician or other qualified healthcare professional. These codes 99446, 447, 448 and 449, they conclude with verbal opinion report and written report. Whereas 99451, it concludes only with a written report. Verbal opinion report is not present while reporting 99451. And the telephonic, internet or electronic health record consultations, when the time is less than 5 minutes, they should not be reported separately. Consultations of less than 5 minutes should not be reported. If the time is less than 5 minutes, you should not report. And the consultant communication with patient or family may be reported using these set of codes. The consultant communication with the patient or family may be reported with these set of codes, and the time related to these services, that is the above services 98966 and so on till 99443. The time related to these services is not used in reporting the 99446 and 99447, 99448 and 99449 services. Time spent for these services should not be included or reported for coding these services. And one more important point is, do not report 99358 and 359 for any time within the service period. Within the respective service period, you cannot report 99358 and 359 if we are reporting 99446, 447, 448, 449 and 99451. Provided the time is within the service period of these particular CPTs. If it exceeds more than 30 minutes and if the patient is not present, then you can use these codes. When the sole purpose of the telephone or internet or electronic healthcare record communication is to arrange a transfer of care or other face-to-face service, then these codes are not reported. This point is clear. If the consultation is just to arrange a transfer of care or to provide other face-to-face services, then these codes should not be reported. And the treating or requesting physician or other qualified healthcare professional may report 99452 One more code is 99452. If the spending time is 16 to 30 minutes in a service day, preparing for referral and or communicating with the consultant. The requesting physician can report 99452 if he spends up to 30 minutes in a service day preparing the patient for referral and or communicating with the consultant regarding that referral. And do not report 99452 more than once in 14-day period. This is an exception from the other codes. 994462, 99451, the grace period is within 7-day period. But for 99452, do not report 99452 more than once in a 14-day period. The period is 14 days. And the treating or requesting physician or other qualified healthcare professional may report the prolonged service codes 99417 and 418 for the time spent on the interprofessional telephone or internet or electronic healthcare record discussion with the consultant. If the time exceeds 30 minutes, if the time exceeds 30 minutes beyond the typical time of the appropriate E&M service performed and the patient is present and accessible to the treating or requesting physician or other healthcare professional. So you can report 99417 and 99418, that is the prolonged service codes, along with the interprofessional telephonic, internet or electronic healthcare record discussions if the time exceeds 30 minutes beyond the typical time. If it is more than 30 minutes, then you can report the prolonged service codes also along with these consultation codes. If the interprofessional telephone or internet or electronic health record assessment and management service occurs when the patient is not present, here the patient is not present and the time spent in a day exceeds 30 minutes, then the non-face-to-face prolonged service codes 99358 and 359 may be reported by the treating or requesting physician or other qualified healthcare professional. Now coming to CPT description, the first one is 99446. Interprofessional telephone or internet or electronic health record assessment and management service provided by the consultative physician or other qualified healthcare professional, including a verbal and written report to the patient's treating or requesting physician or qualified healthcare professional. 5 to 10 minutes of medical consultative discussion and review. Whenever medical consultative discussion and review takes 5 to 10 minutes, then you can report 99446. And the medical consultative discussion should occupy the majority of the consultative time. It should be more than 50%. And whenever the review of labs is more than 50%, then we should not quote the consultation codes. Next CPT is 99447. This requires 11 to 20 minutes. 11 to 20 minutes of medical consultative discussion and review. The next is 99448. It requires 21 to 30 minutes of medical consultative discussion and review. And next is 99449. It requires 31 minutes or more of medical consultative discussion and review. The next CPT is 99451. Interprofessional telephone or internet electronic health record assessment and management service provided by consultative physician or other qualified healthcare professional, including a written report to the patient's treating or requesting physician or qualified healthcare professional 5 minutes or more of the consultative time. This includes just a written report. Verbal report is not included in these services 99451. The next CPT is 99452. Interprofessional telephone or internet electronic health record referral service provided by the consultative physician or other qualified healthcare professional. 30 minutes. When the time required is 16 to 30 minutes, you can report 99452 according to the guidelines. And the requesting physician can also report 99452. Here it is described that provided by consultative physician. The requesting physician can also report 99452 whenever the time spent is between 16 to 30 minutes for the referral and communicating with the consultant. Let us see an example. An otolaryngologist consults with a requesting physician using audio-visual, telephone or virtual form of communication. Here, the otolaryngologist may report these consultation services. An otolaryngologist consults with the requesting physician and the time spent is 10 minutes. So the appropriate CPT is 99446. Interprofessional telephone or internet electronic health record assessment and management service provided by the consultative physician or other qualified healthcare professional, including a verbal and a written report to the patient's treating or requesting physician. The time spent is 5 to 10 minutes of medical consultative discussion and review. Here the time spent is 10 minutes of consultative discussion and review. So we are reporting 99446. Now let us discuss one more example. An otolaryngologist performs an E&M visit for an established female patient with one-sided hearing loss. The otolaryngologist performs an in-office computer tomography (CT) scan in order to identify a mass. The visit lasts for 40 minutes. This is a regular established E&M visit. Immediately following the visit, the otolaryngologist requests a consultation with neurosurgeon to discuss surgical options to access and removal of the mass. The phone call lasts 20 minutes and the neurosurgeon spends another 10 minutes writing a review to be sent to the otolaryngologist. So here the phone call is 20 minutes and additionally the neurosurgeon is spending 10 minutes writing a review to be sent to otolaryngologist. The consulting neurosurgeon will report the appropriate code, that is 99448. Here the total time is 20 plus 10, that is 30 minutes time is spent by the neurosurgeon. So the neurosurgeon will report 99448. Interprofessional telephone or internet or electronic health record assessment and management service provided by the consultative physician or other qualified healthcare professional, including a verbal and written report to the patient's treating or requesting physician. Neurosurgeon is also spending 10 minutes writing a review to be sent to otolaryngologist. So 21 to 30 minutes of medical consultative discussion and review. Let us see one more example. 55-year-old female established 55-year-old female established patient presents with left breast pain and swelling, and the physician suspects mass of breast and orders an ultrasound. Left breast mass is diagnosed and the physician orders for biopsy. The biopsy results indicate malignant tumor and the physician requests a consultation. Here the requesting physician requests for consultation with oncologist and discusses the surgical removal of mass and other options. The phone call lasts for 30 minutes. Then the physician educates the patient regarding the treatment options as discussed by the oncologist. Here the requesting physician can report 99452 because he has spent 16 to 30 minutes of time in obtaining the referral and communicating with the consultant. Here the physician, requesting physician can report 99452 interprofessional telephone or internet or electronic health record referral service provided by the consultative physician or other qualified healthcare professional care 30 minutes according to the guidelines. This CPT is given for the physician, requesting physician 99452. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.